Hello everyone, and welcome to today's webinar, COVID, Kidneys and Coping, Ask Your Social Worker. Before we get started, I would like to go over a few items so you know how to participate in today's event. You've joined the presentation listening with your computer's speaker system by default. If you would prefer to join by telephone, select the arrow next to the unmute icon on the bottom of your screen in the Zoom toolbar. Select Switch to phone audio, and then select phone call and follow the prompt to dial in. By default, all participants enter the webinar with audio muted. Thank you to everyone who submitted questions by email. Please note that your exact question may not be able to be answered directly, and we will be unable to provide medical advice for specific issues. In order to address as many questions as possible, we have reviewed all the questions that have been submitted and will answer those of a similar nature collectively. Thank you for your understanding if you do not hear your question specifically mentioned. For those of you joining on your computer, you will have the opportunity to submit text questions to the presenters by typing them into the questions pane found in the Zoom toolbar at the bottom of the meeting window. Please avoid using the chat box to submit your questions. It helps us to monitor them more effectively when they're all submitted in the Q&A pane. You may send your questions at any time during the presentation. We will collect these and address them during the Q&A session at the end of the presentation. In order to protect your privacy, when you ask a question, please do not use your name or provide any other personal identifying information. Today's webinar is being recorded, and you will receive a follow-up email within 24 to 48 hours with a link for on-demand viewing. I would like to introduce our moderator for this webinar, Lydia Lauder, National Director of Programs and Public Policy at the Kidney Foundation.
Thank you very much, Janice, and welcome everybody. The Kidney Foundation of Canada would like to thank our sponsors for making the 2020 Kidney Foundation webinar series possible: AstraZeneca, Horizon, Janssen, Otsuka, and Paladin. COVID-19 is a serious health threat, and the situation is evolving daily. In these uncertain times, it's normal to feel anxious, especially for those with underlying health conditions. Talking to the people you can trust and getting information you need can help. The Kidney Foundation, in collaboration with the Canadian Association of Nephrology Social Workers, CANSW, and the Canadian Society of Nephrology, are proud to present COVID-19, Kidneys and Coping, Ask Your Social Worker. This webinar will give you the opportunity to ask social workers any questions you may have about coping, financial and employment supports, and anxiety about work, life and society, finding your new normal. We have a number of presenters today, and I look forward to introducing them all to you. Rachel Solium is the Executive Director, Corporate Affairs and Strategic Projects at Valtech Fabrications, Inc., and a lawyer specialising in labour and employment. Jodie Max, Registered Social Worker, works in the Kidney Transplant Program at St Paul's Hospital in Vancouver, BC. She's currently the BC representative for CANSW. Diane Levesque is a graduate of Dalhousie University School of Social Work. She's the CANSW Secretary and member of the CANSW Executive, and has been employed with the Health PEI Provincial Renal Program. Tricia Hutton, a registered social worker, is a medical social worker with the Saskatchewan Health Authority. Tricia is currently the Vice President of CANSW. Samantha Mason, registered social worker, is the nephrology social worker for the Yarmouth, Nova Scotia Dialysis Unit and Kidney Clinic for Yarmouth and surrounding areas. Samantha is currently the Atlantic Canada representative for CANSW. Behind the scenes of this webinar, we're also pleased to have the following renal social workers from across the country who will be available to answer any regional specific questions and who will be responding to some of the questions as they arise in the Q&A panel. Michelle Jensen works with dialysis patients and kidney donors at the VG site of the QE2 Health Sciences Centre in Halifax, Nova Scotia. Corinne McNabb is the President of CANSW and has been with the Regional Kidney Care Program of Simcoe Muskoka in Orillia, Ontario since 1999. And last but not least, Shirley Pulkinen has been a nephrology social worker for 30 years, involved with all aspects of the Algoma Regional Renal Program in Sault Ste. Marie. Welcome everybody. And over to you, Rachel.
Hi there. So one of the hot topics of late, as we kind of make our way through the COVID-19 situation, is managing the gradual return to physical workplaces and all of the concerns and anxieties that go along with that. Now, for some people, that may be returning to reopened work environments that have been closed during the pandemic, or people who have been working from home and then gradually those workplaces are reopening their physical spaces and asking people to return to physical workplaces. So how you perceive that return to work will depend on a number of different factors. It will depend on the type of workplace that you're going back to and the type of work environment that you may find there. It will depend on your personal health situation, obviously, and it'll also depend on more generally your level of anxiety with the COVID-19 situation. So if we look at it from a very practical perspective, the baseline rule, and this is across all Canadian jurisdictions, is that everyone's entitled to a safe working environment. And so what does a safe working environment look like in a COVID-19 kind of scenario is something that a lot of people have been working on and thinking about over the last couple of months. So obviously, as people come back into physical workspaces, there are guidelines for the types of measures that employers should be putting in place to make sure that they're coming back into a work environment that's safe for everyone who's working there. So what that may mean is there may be adjustments to the physical workspace to ensure that appropriate distancing can be respected at all times. There may be extended work from home arrangements for positions that lend themselves to it. You may have the staggering of work shifts, of meal times, of break times, of other times when there's a propensity for congregation and where social distancing becomes more difficult in the workplace. There may be the availability of personal protective equipment, and that again depends on the type of workspace that you're in, whether that be masks or visors or different things that may be recommended depending on your particular functions. And then as well, there may be changes to scheduling to have fewer people in the work environment at the same time, job sharing and different measures like that. Now people who have particular concerns or who consider themselves to be at a greater risk or particularly vulnerable to infection and who as a result will probably have a higher level of anxiety in a COVID-19 reality, they can request additional protective measures. And generally speaking, the health and safety boards from province to province have guidelines in place, and they all recognize that those people who are particularly vulnerable will likely be entitled to additional measures or additional systems being put in place to accommodate their particular needs. Now, what that will be and what a safe working environment is for those particular people will depend on their specific situation. And it may be different from one person to another. That being said, it still must be based on a reasonable assessment of the actual risk that's involved. So with people who are shown to be particularly vulnerable or who have particular needs in this environment, then at that point you can work with your employer to identify what the particular risk factors may be in your work environment and to identify whether there are workarounds that may make it, that may accommodate it to you and make it a safe working environment in consideration of your particular needs. So in the vast majority of cases, I would say there are ways to work around that, and what people have put in place is either changes to tasks or changes to the physical workspace to further isolate those individuals who may be more vulnerable. Now, in cases where those additional measures are not sufficient and where there's still a heightened risk associated with being back in a physical work environment, then each province has specific rules around work refusals for health reasons. And in those cases, to the extent that an individual is not comfortable, despite all of the measures that are being put in place and the accommodations that may be available, is not comfortable with the level of risk in their physical work environment, then they should consult with the Provincial Workplace Health and Safety Authority to get advice on how those rules might apply to them and how they go about exercising a work refusal, and then what the consequence will be both from a practical and a financial perspective. As a final comment, I'd say it's exceedingly important to make sure that you yourself are properly informed about the actual and objective risks to your health, because in these types of discussions, we do have to differentiate between anxieties, which everybody in this situation has to some degree, and the actual health risks that you may present by reason of your health situation. And so that concludes on the issue of the return to physical workplaces.
Sorry, everybody. I didn't realize I was still muted. My apologies. So thanks, Rachel. So for those of you who are not able to either go back to work or possibly weren't working when COVID landed on us all, I'm sure most of you are familiar with the CERB, the Canadian Emergency Response Benefit, but we just wanted to highlight some pieces here. So as you may already know, it is a temporary income that the federal government has developed for Canadians who stopped working due to COVID-19. So again, layoffs or reduction in hours, or had to stay home because of sickness or quarantine, or you were taking care of either family members who were sick or kids who no longer had schools that they were going to. The main thing to keep in mind is if you did have a job, it's important that you didn't quit your job voluntarily, and because that could make you exempt for this. So you can get $2,000 for a 4-week period, which comes out to $500 a week, so $2,000 a month, and you can reapply for up to 16 weeks total. So in order to qualify, you must have had work income of at least $5,000 either in the last 12 months prior to applying for CERB or throughout 2019. That includes self-employment, which didn't used to be, obviously is not something that's eligible for EI. So self-employed people who earned $5,000 would qualify. And it also includes folks who were on maternity or paternity leave as well. While you're receiving CERB, you can earn a little bit of money, but not more than $1,000 in employment income a month. You have to reapply for CERB every 4 weeks, and you may have to repay it if you're not eligible. And it is taxable income. So there's actually quite clear instructions online for how to apply, and it's quite an easy process. I've known a number of people who've applied, and they've talked about how quickly they get approved for it. So it's good that they're doing it much quicker than a lot of other processes. So you can see on the slide here that you can either apply by phone, or you can do through your tax service if you've done that online before, or you can go online to their website. Next slide, please. Okay, so there's been a few common questions regarding CERB. So for those folks who were already on EI, employment insurance, if you were receiving or eligible for EI benefits before March 15th, you would continue to get those benefits and should not apply for CERB. If EI benefits run out before October 3rd, 2020, you can apply for CERB once EI claim is exhausted. I just want to make a note here that I know that so far we've heard CERB being available for 4 months, and I believe October is a little bit later than that. So obviously if COVID's still going on, which we expect it will, they'll be extending CERB benefits. So if you already applied for EI after March 15th, you don't have to reapply for CERB, and your claim will automatically change over. So there's a lot of folks who were confused about whether to apply for EI, whether to apply for CERB. My understanding is that they actually are figuring that out for you. So you don't have to be as worried about that. The government will make sure that they've got you on the correct form of support, whether it's CERB or EI. So if you're sick or laid off after CERB runs out, then you should be able to apply for EI benefits after October if you're still sick or unemployed. And again, to qualify for that, at this point, you would need 420 to 700 hours of work over the year prior to receiving Serb. And for EI sickness benefits, you'll need 600 hours of work over the year. On that note, I wanted to say that, of course, a lot of you have seen this, that things are changing all of the time and quite often. So this is how things stand right now. And it could be different in a month from now, and it certainly could be different by October. But this is what we know right now. And if you don't qualify for EI, so again, somebody who is self-employed, or maybe you weren't employed at all as of March, but you earned $5,000 in the last year, then Serb is available for up to 16 weeks. Okay, so thanks, and we'll be over to Diane now.
So here's a brief look at some of the other available financial supports throughout Canada. So the newest benefit for Canadian students, college, university, high school, who are unable to work due to COVID-19. So it looks like it's $1,250 a month, increases to $2,000 for students with dependents and with disabilities. You can make those applications through the Canada Revenue, through the CRA, and the eligibility period is between May to August 2020. There's also the Old Age Security, the OAS, and the GIS, the Guaranteed Income Supplement, one-time payment. So as of May 12th, 2020, any senior who is eligible for the OAS pension will receive $300 tax-free payment. An additional $200 tax-free payment is being sent to seniors eligible for the GIS, total of up to $500. So there's websites on there if you want to look at those. Some other available financial supports is the Kidney Foundation of Canada. So many of you may already know of this through your social worker, but there's short-term financial assistance available to patients to cover medical and other expenses associated with kidney disease and its treatment. However, please note that it's provided only when all other sources of funding have been exhausted. And some regions have additional relief measures specific to COVID-19. So please ask to speak to your renal social worker. Next slide, please. So what I wanted to do is provide a brief overview of what each province is providing. So keep in mind that this may have changed as this was publicly provided at the end of March. However, I was able to update some of the information this week. So I'll start with BC. So hopefully we have some people from all over Canada listening in, and you'll hear your province. So BC Emergency Benefit for Workers, which will provide a one-time payment of up to $1,000. Families with low or medium income will receive larger than usual climate action tax credit in July. And the provinces will provide up to $500 a month to renters who are at risk of losing their home. People need to keep in mind they need to make sure they file their income tax to be eligible for the BC Climate Action Tax Credit. So we'll move along to Alberta. Anyone in Alberta who is self-isolating or the sole caregiver of someone who is self-isolating can apply for the emergency isolation support payments. Announced on March 18th, the program offers a one-time payment for $1,146. In Saskatchewan, residents who have been ordered to self-isolate, and are not eligible for the federal supports can apply to the province's self-isolation support program, which was announced March 20th and provides recipients with $900 over 2 weeks. The province has said this will mainly benefit self-employed workers. In Manitoba, the Seniors Economic Recovery Credit provides a $200 one-time refundable tax credit to Manitoba seniors facing additional costs due to COVID-19 pandemic, such as like groceries deliveries and technology purposes to stay connected with loved ones. Moving along to Ontario, low-income seniors will also see increases in their usual payments from the province for 6 months. Some families will be newly eligible to receive support. For example, paying hydro bills. An example is $500 for electricity bills or $500 for hydro. And access to the Ontario Works Income Support Program will be expanded as well. They've also provided funding to help pay for things related to COVID-19, like cleaning supplies, transportation, and clothing. If you are an Ontario Works or ODSP recipient, you can get this additional funding by contacting your local Ontario Works or ODSP office. If you're a low-income senior or a person with a disability in needs such as those in supportive housing, environments, or community-based independent living programs, you can get paid or subsidized delivery of meals or delivery of medicine or other necessities. Moving along to Quebec. So basically there are a number of government assistance programs available for workers or residents of Quebec who have lost their income because of COVID-19. So if you go to the quebec.ca website, this tool will help you determine what type of assistance is available in your situation. In New Brunswick, legislation has been introduced to provide job protection for workers who must take a leave of absence due to COVID-19. It will allow an unpaid leave of up to 15 weeks for New Brunswickers who have had COVID-19 or caring for someone with the virus. And also New Brunswick is offering $400 annual benefit to qualifying applicants for low-income seniors. They are also providing childcare relief for those who have lost their income due to COVID-19 or essential workers. For example, if you've had to double pay for childcare, they will help with that. In Nova Scotia, residents on income assistance are receiving an additional $50 with each payment as of March 20th. They also are providing cell phones to the most vulnerable. So the government has partnered with TELUS to provide 100 phones and calling plans to the most vulnerable with the Department of Community Services. So clients who have no other means of communication and who may be self-isolated and alone. There's also the Worker Emergency Bridge Fund. This fund supports people who are self-employed or laid off or who don't qualify for employment insurance. And applications open April 10th, 2020. Moving along to Prince Edward Island. So anyone who lives and works in PEI earns $25 per hour or less and lost their job between March 13th and March 31st is eligible to receive a $100 gift card for Sobeys. Now, I'm not sure if that has been closed or not, as many of the provincial government programs that I had researched are now closed. However, if you are self-employed, a worker, or a business, there are supports, and to please call 1-866-221-1751. Newfoundland and Labrador. The provincial government in Newfoundland and Labrador announced March 14th that will compensate private sector employees to ensure employers do not go without paying. Private sector employers to ensure employees do not go without pay during the pandemic. And Newfoundland Power and Newfoundland Hydro have also announced that they will not disconnect power from users during the COVID-19 crisis. The power company will also offer flexible payment options for users who cannot make payments during that crisis. And residents who use other heating methods such as oil, propane, and wood should contact their service providers for additional offerings in that area. The Yukon, this territory is providing rebates to employers to cover workers' time off due to self-isolation requirements, up to a maximum of 10 days and $378 per day per employee. In the Northwest Territories, funding to the Income Assistance Program in the Northwest Territories is being increased, and they announced this back in March, back at the end of March. And Nunavut. As of April, the Nunavut government has not announced any specific direct financial assistance for residents affected by COVID-19. I just want to make note that these are financial supports that are changing daily. So please speak to your renal social worker in the province where you live Also, if you go to each province's homepage, most of them have a listing of each item that I discussed here with you, and there's phone numbers or internet addresses that you can contact. Thank you.
Okay, so I wanted just a moment to chat about some of the impacts due to the pandemic. So our usual ways of coping have changed. And so sometimes we might notice pieces of anxiety or depression. Our sleep might be a little bit altered. We could be using substances more than what we would normally do. Our appetite may have changed. So it might have increased or it might have decreased. We might have trouble concentrating, or maybe we're forgetting things that we usually wouldn't be forgetting. And the ways that we usually practice rituals, such as families, memorials, birthdays, all of those types of things, is a little bit different because we can't get together with our families or our friends the same way that we would usually do during those events. And then the other thing that's going to be quite different is grief and processing grief, kind of going through how do we remember someone when we can't get together with that family to celebrate or to grieve together as a group. And so with those things being so different, we're going to notice different changes in regards to our emotions. So worry and anxiety, next slide. So worry and anxiety, worry is only in the mind, whereas when it moves to more of an anxiety piece, you're going to notice, you're going to feel that in the body as well as the mind. And so that's just something to keep in mind. If you have concerns about worry or anxiety, we would just recommend that you connect either with the social worker in your unit where you're at, or maybe even look into seeing if there's some counseling available in that area who can help you process through that and help kind of untwine that a little bit. And then getting back to the new normal. Things probably aren't going to go back exactly the same as they were before. We're going to see things different. We're starting to see some loosenings of restrictions across Canada. And of course, each province is going to do that at a different rate and a different time. So some of the things that we might be starting to see is the groups that we are able to meet with are getting a little bit larger. We're able to possibly expand our housing bubbles or starting to be able to meet with immediate family. So those are all really positive things. We do want to make sure that we're taking precautions, remaining socially distant. You know, if we're having a cough or fever symptoms, that we're not going out to meet with others. We're washing our hands frequently. Going back to work. Again, having clear communication with your employer. What does that look like for you to go back to work? Are there other areas where you could work that you feel might be a little bit safer or that would meet your needs a little bit better? What options do you have in regards to sick time if you're not feeling well and not able to come into work? Sending the kids back to school or daycare. Again, find out what kind of new processes are in place. I know a lot of times the amount of children that are going to be in the classrooms or in the daycare rooms have been limited. And so what does that look like for your family now? And again, making the best decision for your family, because each of you are going to be so different and unique. And then looking at grocery shopping. So keep doing your grocery shopping, limiting it to, you know, maybe one trip a week, making sure you're washing your hands lots of times while you're there. It is a good idea to wear a mask just to help, again, make sure you're not spreading anything to anyone, and it's a little extra barrier for you as well.
Thanks, Tricia. So I'm going to talk a little bit about coping with a pandemic. So this is all very new for all of us, not something that we've dealt with before. But as Tricia pointed out, the pandemic is bringing about a lot of new changes for us. So the effects that we're having are being noticed in our mental health, on events in our life, and life goals. So one of the things I wanted to talk about a little bit is life goals and healthcare goals. So you guys may have experienced some of these things already. Some people are on hold for transplant training, planning, and training for home dialysis may be on hold for you. You may have had a surgery postponed, or maybe even a wedding. So I know that's a little bit of a varied amount there, but we just wanted to point out that there's so many things happening right now that we know that flexibility and patience is all we can do during these times. But one of the things with healthcare goals is normally if we had some of these losses, if we had a surgery that was canceled, those kinds of things, we would have normal coping mechanisms that we would use that aren't available to us during this time, like meeting with family and friends, going out for dinner, whatever it may be. And if those things aren't on hold, this makes this just that much more hard. So one thing that we wanted to point out that may be reassuring to some people is going over your healthcare goals and your plan with your healthcare team and adjusting where necessary. This can help bring some control back to a situation that is really lacking in control right now. One tool that is on our resource slide at the end is advancedcareplanning.ca, and it's every province has a little place on it that you can click, and it shows you exactly what to do for the plan in your province. Another thing that a lot of people are probably feeling is fear, and one way to help with that is to educate yourself with facts from reputable sources. So we do have a few of those on the resource slide as well, but some I would recommend would be Health Canada or the Kidney Foundation or your local, your provincial page also has a lot of information on COVID. It's best to limit your time for social media and the news because it can get overwhelming. Even if there are facts there, sometimes it can be a lot to just be pushing on you all the time. So some people just check once a day or check in once a week, like whatever works for you, because everyone is a little bit different when it comes to this. But knowing the facts and what you can do to help yourself can reduce fear and bring back some control, which is another reason why the Kidney Foundation is doing these webinars and this one today. So I think the biggest thing to think about when coping is to do self-care. Now, I know that's a word we throw around a lot and people sometimes don't really know what it means. I think everyone envisions like bubble baths and that kind of thing. And it works for some people, but it's not for everyone. So you have to remember that self-care includes a bunch of different things. It includes social, physical, emotional, and spiritual parts of who you are. So you have to look at all of those aspects while you're choosing activities for yourself. But a lot of things that are recommended are exercising, eating healthy, getting enough sleep, spending time in nature or with your pets, and engaging in spiritual activities that are meaningful to you, and enjoying leisure activities that are meaningful to you. And it's all varied because every one of us is unique and we all have different ways of coping with stress. So, so that's what we encourage. I must say that the resilience of humans always amazes me. And on the slide, we have birthday parades. That was one thing that I thought was very interesting about this time. Couldn't have a regular birthday party, so people are out asking fire trucks and ambulances to come and do a birthday parade, family members and friends going by. I think that's really interesting and a different way of celebrating during a time when there's chaos. And video chats are really important, trying to connect with family and friends virtually. So that's always something that we would encourage. Next slide, please. So to help you find your way, like I said before, is we would look for that information from the reputable sources. So public health is a good one. Every province has their own, and they're going to direct you to good information about COVID-19, and Health Canada as well, Kidney Foundation, all of those. And of course, your social worker that's connected to your health clinic and to your dialysis unit, it would be a good person to reach out to. And any member of your kidney health team. Most of our teams come equipped with a lot of professionals who have different answers to different questions you may have. But if you're feeling worried or upset about anything to do with COVID, just reach out, and I'm hopeful that your team will be able to answer those specific questions that you need answered. Another support is the Kidney Foundation of Canada Peer Support Line. So the numbers there are on your screen, and it'll be available on the slides later on, or you can go to kidney.ca and their peer support link is there. This is a great tool if you're looking for support from somebody who is going through something similar that you are. You can be connected with another person from across Canada and have chats that way. So that's another option. Of course, another option too would be provincial mental health services, like Tricia mentioned. A lot of provinces have mental health crisis lines. So if you're in a really bad place and you need to talk to someone right away, there's usually a free line that you can call. I'm not going to direct you to any in particular just because there's probably so varied across Canada, but that is usually an option. And of course, mental health services. And that's something that your social worker can definitely help you out with. So the next slide is a picture, and this kind of goes back to what I was saying about self-care and wellness. So as you can see, there's 4 parts to the circle, and this is what I like to think of when I think of self-care, that there's these 4 parts to us. We need to address social, physical, spiritual, and emotional pieces when we're looking at health for ourselves. We're not just one thing, and we need support from all of these areas. So when you're thinking of self-care, I challenge you to consider what aspect of the circle it's coming from, and if you are addressing all of these, that may help with some of your anxiety. Next slide, please. So before we move on, we just wanted to say that as social workers, we wanted to tell you guys that you're so brave. We're always so impressed with the patients and caregivers that we work with. You guys go through an extraordinary amount of change and hardship on a daily basis. And with COVID-19, it's just made it 10 times worse. And we're there with you. We really are so proud, and we are amazed by your resilience, your strength, and your courage. We learn so much from you every day. And I don't think that this time is going to be any different. Thanks.
So I just wanted to take a moment to go through some of the resources that we have available for you. This link, or the slides here that we have are going to be available on the CANSW website, and all of the links are live on the end of those slides. So you can go look at those slides, click the link, and it will take you directly where you need to go. So there's also going to be a link to the CANSW website from the Kidney Foundation, but if you wanted to go directly to the CANSW website, it would be CANSW, CANSW.org, and in links there is the slides there for you. So the ones to point out would be under mental health, the fourth one down, Guide to Living with Worry and Anxiety Amidst a Global Uncertainty. And that's one that I use quite a bit with some of our patients here and has proven to be quite helpful, as well as the article there about the difference between worry and anxiety. And then on the next slide there's some resources in regards to grief, mindfulness, there's some legal information there, advanced healthcare planning, as well as some information on exercise. And then carrying on to the last slide with resources, we have the Health Canada information, as well as the kidney.ca. And both of those sites will be able to give you so much more information than what we could cover. Thank you all. And again, you are so brave. Thank you for bringing that up, Sam.
Well, thank you very much to our panelists today. It's very interesting and very informative what they've brought to the table and all the information that they've shared with us today. And we've had quite a number of questions come through that I'd like to share with you all and open it up to the panel to answer. And one of the first questions that have come through, and Michelle Jensen, I might refer to you and also open it up to any other panelists, was with the relaxation of restrictions. How do I convince friends and family that we will always be at extra risk and that to be safe, we must remain as isolated as possible? I'm wondering, Michelle.
Lydia,
Yeah.
I had thought that this would be a good one for the whole panel to discuss. And I think the first step is really trying to have open communication with your family and friends. Let them know about your concerns and your anxiety, and feel free to talk with your renal team as well to see if they have any specific suggestions that they think would be helpful. I think what I have heard from family members of dialysis patients that I work with is that they share concerns on behalf of their loved one who's on dialysis. So I think it's important to have some open communication, but I open it up to the whole panel if there's any other suggestions.
I agree with what Michelle said. The one thing I would add is you could combine what your renal team is telling you with whatever the provincial medical health officer is telling you to do. And what the provincial medical health officer may be telling people to do doesn't necessarily apply to kidney patients, of course, or folks who have compromised immune systems. So that's why it's good to combine both together.
Would anybody else from the panel like to comment?
I'll say something. So, I mean, I think what Gloria is saying is that she's worried about how her family is reacting, and there is a lot of fear here for, especially for our patients who are immune compromised. So, I like what Michelle said about trying to talk about your feelings with your family and opening that up as a discussion. It's hard to do sometimes, but it may open up that discussion for them so that they understand how you're more at risk than everyone else, because the provincial regulations are going to be a little bit different. So that would be where I'd suggest to start.
Okay, thank you very much. We've had a question from Isabel. Do we know if those patients who were over 60 years of age, if they had a comorbidity or trouble, sorry, I'm just trying to read this one again. So people over age of 60, were they at more risk if they had other comorbidities or had lung problems at first either? Is that something you're able to respond to, or should we be referring that to people's dialysis or renal teams? We might refer that one to the renal team. The other questions that we've had answered, I just wanted to go through some of those because there's been some really great questions come through, and I think they'll be of value to the people who are joining us today. And this one may be to the social workers and also to Rachel. Eric had a kidney transplant in December and was temporarily laid off due to COVID. Once businesses opened up and social distancing measures are relaxed, as someone who's immunocompromised, what should they do? How long should people who are immunocompromised stay at home and keep self-isolating, particularly before a vaccine comes along? And I'll open that up.
So I think that was answered briefly. There's been a couple of kidney transplant questions, so I'm happy to take those. So most importantly is really to talk to your nephrologist about specifics for you and the area that you're in. But you know, along these lines, I wanted to combine this with another question that had come up of somebody asking about statistics in kidney transplant patients. So one of my nephrologists, Dr. John Gill, is very involved internationally with transplant associations around the world. And he shared with our team some preliminary statistics. Now, my understanding is each region, each province, or different regions within each province is going to have a transplant association that's going to try and be coming up with a consistent message and a consistent sort of set of information that might go into letters that nephrologists might be able to provide. And I know the BC Transplant Association is trying to do that here as well. And so just about a week and a half ago, he shared with us that the early statistics coming out of Spain showed that transplant recipients have an estimated 50% higher risk of infection with COVID than the sort of general population, and that when they require hospitalization, there's a 20 to 30% mortality rate. So that is quite significantly riskier for transplant patients. So again, most importantly is to talk to your nephrologist and your kidney team about what is best for you.
think that's really good advice, and thank you for that, Jody. Always knowing that personal situation and that individual situation is best spoken to with the people that know you the best as well. So
if I may, Lydia, just chime in for a moment on that question as well, because
Sure.
it does, there's a potential impact also on the work environment, right? And if you're, one of the questions that you're dealing with is whether or not you are going to be able to return to work. So the business that I work for, we have 170 employees, in both manufacturing type employees and administrative employees. And and among those employees, there are certain people who have different health conditions that put them at greater risk. One of the difficulties of this particular situation is that we don't know how long the situation is going to go on for, and how it's going to evolve. And so it's not like you can make a decision. A decision may be your preferred decision for today, but should this go on for another 6 months or a year or 18 months, you may not be able to sustain that decision. And so I think it does require, along with your treating physicians or your healthcare team, to kind of determine what type of scenario will be an acceptable, will present an acceptable risk level for you. So it's a similar situation that when we're bringing somebody back into the workplace after any kind of prolonged absence for disability or illness, where you would ask your employer to say, okay, what measures are you willing to put in place to limit the extent of my exposure and to limit the risk profile of my presence there. And then you would bring that along to your healthcare team, and you would present that to them and say, if these measures were put in place, and if this were the reality that I was going into, is this an acceptable risk level for me? And so then it's a dialogue back and forth between your employer and your healthcare team, and to see if you can come to some kind of a common ground where everybody's comfortable with the risk level, because the reality is that the risk level is never going to be zero, but that may be the reality for a very long time. And so within that, you have to kind of try to get to a best case scenario for each individual.
Thank you for adding that, Rachel. And that makes me want to just add that we do have a number of kidney transplant recipients who are resuming work with those safe distancing practices in place. So again, it really comes down to the type of work you're doing. We also have transplant recipients who are healthcare workers. So that's a little bit different, because our nephrologists have said that we don't want any transplant patients coming into direct contact with known COVID cases. But if you're in a work environment where nobody is likely to be sick, that's a whole other story. So it's certainly possible depending on your individual situation. So thanks, Rachel.
Thank you, Rachel. We've also had some thank yous in the Q&A box as well, so we appreciate that. And just expanding a little bit upon this, we've also had a question whether there's any literature available for returning to work for kidney transplant recipients. This would be useful for advocating to employers that are questioning isolation in some instances. And I'll open that up to Jody and Rachel as well.
I don't know about you, Rachel, but from my end, there's no literature yet, but we have been providing letters from a nephrologist that is specific to that patient. And again, as I mentioned, each region has a transplant association that also, I believe, would be wanting a consistent response from nephrologists, so that not all the thousands of transplant patients are getting individual letters. But I'll leave that over to Rachel now.
Right, I'm not aware of anything in particular either. One of the, one phenomenon that we see is that the information that's available is getting more and more specific. So it takes some time before different organizations and different kind of focus groups can do the research and get materials out to different communities of people. And so I think the guidance will become more and more specific as time goes on. But for the time being, I haven't seen anything so specific.
Okay, thank you very much. And we're seeing a number of questions coming through both prior to the webinar and also during the webinar. We've seen a few come through in regards to masks. And I know that this is a real hot topic of conversation for a number of people. It's been a hot topic throughout our whole webinar series. And I was wondering if anybody would be willing to comment on masks, knowing that they're slightly different variances between renal units, regions, local areas, provinces, and federally as well. So I'd just like to open the floor and just get a few comments about wearing masks, when they should be wearing masks, and also about medical and healthcare staff wearing masks as well. And everyone's gone silent on me.
I wanted to give others a chance to talk because I know I've said a lot.
I can say something on that if that's okay. I don't know if anybody
Yeah,
can.
go for it. Go for it, Diane.
I know it's a hot topic. We hear it everywhere. We hear it in the news. I think everybody should be listening to their public health officer in their own province and what the direction is based on each provincial, what they're mandating, what they're recommending, because each province is very different right now in terms of COVID rates. I think that in terms of some of our patients are very vulnerable. Your health, I think that if you can wear one, I would always recommend that you do wear one, even if you're, even if you feel that you're going to a safe place. It can help prevent that spread to other people and perhaps protect yourself as well. And where I live right now, I have to wear a mask wherever we go, and it's really uncomfortable. And but I feel that it's working. So, anybody else want to comment on that?
I just wanted to jump in, and I know in addition to what Diane's saying, I completely agree with it. But the thing to keep in mind is it doesn't take the place of social distancing. So some people get this false sense of confidence wearing a mask, that thinking that they don't have to still maintain the 6 feet apart, but you do still need to maintain the 6 feet apart. And like Diane was saying, the mask is uncomfortable. So one of the things we tend to do is touch our face a lot and the mask to be adjusting. And that's a point of potential infection. So if you're going to touch your mask, just make sure you've got hand wash and you can wash your hands right away.
Yep, some really good tips. Thank you very much, Diane and Jody. Really insightful there, and good tips for people who are wearing masks. We've got another question come through. With the increase in costs incurred via the virus, is there any funding for people on disability?
I can try to answer that. So I really tried hard to find information on that, and I wasn't really that successful, unfortunately. What I can point to you is to go to the Government of Canada website and go on to, I know the main source of funding right now, financial emergency aid, is Serb. However, there are links to go to the Government of Canada, canada.ca website, look and see what's available there. And I would also, you can go onto each of your provincial websites, for example, novascotia.ca or newbrunswick.ca, and look up under persons with disability and see what's available there, because some provinces have things available and other provinces there's nothing listed. So unfortunately, that's not always the answer we want to hear, but it requires a bit of work to go on to the websites. And from what I'm reading too, is that it's frustrating for some because they're calling numbers, and unfortunately not many people may be able to work and are working from home. So they're saying that it's going to take, unfortunately, a little bit longer to answer those questions.
Thanks, Diane. I wanted to add too, please talk to your social worker, because they may be able to answer that question for you in your specific region. And of course, it depends what kind of disability. Are we talking provincial? Are we talking federal? Are we talking private? That's going to vary as well. So your social worker really should be able to help you, especially navigate those long waits. And some of the resources we provided here should be helpful as well.
Thank you. We've also had some pre-submitted questions about people who have been sick during quarantine and what they're a little bit concerned about what's been happening with them, and you know, they just want to work out, you know, how they find information about whether their concerns are valid, how they can see a doctor without being able to physically see a doctor, and if there's any hints or tips or some opportunities there for people to self-advocate if they are concerned about their health, and how they could go see a doctor in these current times when it's a lot of doctors' offices are still closed.
So here in Saskatchewan, most of the doctor's offices are open and you can phone in and speak to your doctor. Some of the doctor's offices also do have FaceTime or those types of things set up where you can have a video conference with your doctor as well. So I'd encourage you to try to reach out to your doctor's office just to see what types of processes they're going through. And then the other option would be to connect with 811. And I think all provinces have a health line, which it may not be 811, but another number similar to that. In Saskatchewan, our number is 811, and speak to them about what the options would be and what your concerns are, and they may be able to give you direction as to how to see a physician as well.
Okay, thank you very much. And we've just had a comment or an FYI just released that the Public Health Agency of Canada is now recommending that people wear face masks in public where social distancing is not possible. And I'm just going to refer that to the panel for further comment on that. Michelle, I might ask you to take the lead on that particular question, and then we can open it up to other panelists.
Thank you, Lydia. I just was wanting to flag that as I saw that in the Q&A panel, and based on the discussion earlier about masks, wanted to highlight that recommendation for all attendees. So I think that, you know, it provides, this is really good, strong affirmation that wearing a face mask, especially when not being able to maintain the 2-meter distance, is a really, really good sound recommendation. And I think people always can feel confident about erring on the side of caution and whatever gives them a greater sense of confidence.
Yep, some very good points there. And we've got another question here that's open about any statistics on how COVID affects the kidney donors themselves. And I know it's early days, but Jodie, just because you do have that experience or expertise in transplantation, I'll open the floor with that question with you.
I would just answer, we don't have any statistics. We just started resuming live donor transplants in the last couple of weeks. So it is definitely too early to tell. What I can say is the process moving forward is swabbing 2 weeks before the surgery and then right before. So we're certainly moving forward with making sure nobody has COVID. But I will just say that kidney donors are perfectly healthy and they're not considered patients in any way. They're considered a healthy kidney donor, so they should not have any kind of compromise to their immune system at all moving forward. So I don't imagine it would be any kind of detriment to them at all. But that's my non-medical opinion.
Thank you, Jodie. Yeah, it's still very early days and we're learning day by day, sometimes minute to minute, just as we had that FYI about the masks. So, you know, things are changing and rapidly evolving, and we'll be watching this space very closely as well. I am referring to another question that was pre-answered by Michelle and the panelists in the back behind the scenes there. And we've had a question about any suggestions on dealing with pharmacies and the increased dispensing costs at the moment. A number of pharmacies, rather than paying one fee every 3 months, are now charging the dispensing fee about 12 times a year because they're monthly. So they would just like to know if you have any suggestions on dealing with it. Somebody has actually emailed their local MPMP, haven't had a reply. So I'm sure that's a situation you've all encountered, and really would think the participants would value knowing how they could work around that. And everyone's gone shy again.
I don't know a workaround. I will say I saw an article yesterday by CBC that Nova Scotia may be lifting that soon. So I hope that means other provinces will be too, because I do know it is a hardship for people. pharmacare is something that we have in Nova Scotia is hard enough to use as it is. So pharmacy fees tend to be high. If it is something you're struggling with personally and you do have access to a social worker who may be able to help you with specific funding, that may be an option for you to look into. But otherwise, I don't know of anything that's really specific for that fee. But it's definitely something that talking to your MP is always encouraged. that's always a good option. But
I can add to that as well, Samantha.
Mm-hmm.
This is Michelle, just picking up on what Samantha has said. We're pleased to see that we anticipate that the dispensing fees are going to be that the situation in Nova Scotia is improving. What I wanted to add is that across the country, it's quite possible that any client of a provincial income assistance program has the means to get some additional assistance with both co-pays as well as perhaps dispensing fees. So it's really important, if you are having an issue with any challenge obtaining medications or being able to afford your medications, that you do speak to your renal social worker.
And I can just add, in terms of the only information that I have here right now, it pertains to Newfoundland and Labrador. So it just says here, individuals receiving income support as a supplement to earnings may qualify for the Serb, which provides substantially higher overall monthly income, and to ensure consistent access to prescription medications at no increased cost. Newfoundland and Labrador Prescription Drug Program Foundation, 100% coverage will be extended to these clients. So that's one thing for Newfoundlanders.
Thank you. Thank you for that. I'm just going to refer a question to our Ontario-based social workers. We've had a pre-submitted question that is in regards to the Trillium drug benefit, and what they're asking about is they're a hemodialysis patient and they're on CPP disability and they don't work. They have Trillium coverage, but they're really finding it difficult to cover their Trillium payout at the moment, and they're going to find, and they're concerned that they're going to find this even more difficult moving on, and are just seeking some general advice about what they could do in this situation. So that would be Shirley or Corinne.
I'm not sure Shirley's answering, but it's Corinne.
Yeah.
I think I'm just going to echo what a lot of people are saying is probably the first line of defense is to speak to your social worker. I haven't heard of any specific advocacy done with Trillium, but certainly if you speak to your social worker, if this is a problem, that is something that they can do, and they would also have knowledge of different programs for funding. As people are saying, different, if you're on social assistance, you may be able to get a little bit of extra funding, sometimes emergency funding through the Kidney Foundation or other places, which could help with this. So I think it's just best to, we can't speak to every specific situation, but the best line of defense would be to start with your social worker and work with them.
Some great advice. We've also had a question about what happens to a student who's collecting Serb and going to college this fall. Will they be eligible for educational benefits as well?
I'm just looking here. I don't have the information in front of me. We'd have to research that. I don't know if maybe someone else has anything on that, but I don't have that right in front of me, that answer, unfortunately.
It's Corinne. I think I had tried to answer earlier. I wasn't sure what the answer to that was, and somebody also answered that you can't be on more than one benefit at a time. So if they're saying, my understanding is you can only apply for one benefit. If you've applied for Serb, you can't apply for CEB, which is the educational benefits, but there might be certainly bursaries and scholarships through the colleges and universities that the student's going to. So I don't think we can say there won't be any assistance at all. And we certainly Don't know how the school is even going to look for a lot of the students, whether they're going to be able to go back to campus, and this will be different probably in each province as well. So I think it's best probably to contact the registrar at the college or university that you're thinking of and find out what is available there.
Thank you very much. And I'm just going to take this into something that is always generally difficult for people, particularly on dialysis, and that's regarding the renal diet, and whether there are any recommendations for eating restaurant food at the moment, given so many shutdowns.
I can answer that one. I would always make sure that if they're asking this question as a patient, that they speak to their renal dietitian first and foremost to get their answers on that, because they have all kinds of good ideas to provide in terms of, you know, how can we avoid getting into a food rut at home, and when there's no restaurants. I know where I'm at, there's no restaurants open at all, but they just opened up drive-throughs through McDonald's. So it doesn't give very many options. Maybe someone else has any other ideas.
Yeah, there's lots of places here opening up for takeout in Nova Scotia, and I think it really depends where you are and what the opening up is looking like where you are. But again, I would say the same to Diane. I don't know about if it's like more risky just to get food from a takeout place. I wouldn't say. All health regulations are still there, food safety, that sort of thing. But you know, always good to talk to your dietitian about what she may recommend, or he, sorry, and what they may look at for what you may want to try first.
There is some really good information on the Kidney Foundation website as well. So as all of us, we'd recommend you chat with your dietitian, just because they're going to be the ones most familiar with your specific case, and, you know, looking at your blood work, which areas of food to avoid or which areas would be okay for you. So Kidney Foundation website, or speaking with your dietitian from your area.
And then Janice just shared another resource with us, which is called kidneycommunitykitchen.ca. And it has resources for a renal-friendly diet, as well as a frequently asked question sheet about eating out right now. So that's kidneycommunitykitchen.ca.
Thank you. And there is also the possibility there where you can ask a dietitian. So if you do have specific questions, please feel free to go onto that site, submit your questions, and we can get our volunteer dietitians to answer them for you. So that service is available. And also watch for our blogs. We've just released some information on navigating a food bank at the moment with a renal diet, and that may be important to a number of the people listening in as well. So that information is available for us there. And thank you. There's also been a lot of questions, and I'm not sure if this is the right panel to ask, but you know, I've seen quite a few of these pre-submitted and also during the presentation, and there's a lot of concern by people who are pre-dialysis or who have chronic kidney disease versus dialysis versus transplantation, and their risk of being immunocompromised or being at high risk of COVID. And I wanted to open it up to the panel to see whether they'd like to comment, just at a very general level, knowing that you're not doctors as such, but just from that healthcare professional perspective, if you'd like to comment at all about immunocompromised patients and their level of risk. I think everybody's gone silent.
I know I've already spoken about the kidney transplant level of risk. We know that's higher because people are immunosuppressed, because they're taking anti-rejection medications that compromises their immune system and suppresses it. I'll just add, if nobody else jumps in, that it really is best to talk to your nephrologist, because every case is so individual about your own situation. Sometimes people have other things going on medically on top of kidney disease that makes things more complicated for you. So it's really best to talk to your nephrologist and your kidney team.
That's great. Thank you very much for that, Jodie. And perhaps, Rachel, I might address this question at you, and I still welcome any of our social workers on the panel to respond as well. But somebody is an educational assistant working in the school system, and she works, or he works, with special needs students. Some are very physical, and they didn't quit, they didn't get laid off, but they're currently getting paid during the school closures at the moment. Are there any suggestions on what measures they could take in a school environment as an employee, and looking at what their rights would be in that situation?
That's a tough one, because you know, one of the obvious reasons why school openings have been delayed in so many provinces, and I'm sitting here in the Montreal area, so we've had obviously we've been hit particularly hard, and one of the consequences that we're seeing is the prolongation of school closures, specifically because it is so challenging to enforce social distancing among school children, especially lower aged children, and especially students who may have special needs. It can be even more of a challenge. So I mean, I don't have the competencies to be able to answer specifically that question. That's really something that needs to be addressed by people who are in the school administration, who have a much better knowledge of the particular environment and the particularities of the children that you're speaking about. But the general principle remains the same as what I was speaking about earlier. You need to look at the situation, identify what the risk factors are, and then determine whether there are any reasonable ways that you can address those risk factors or limit those risk factors in a way that will make sense for the employee, so for the adult in the situation, and also for the children who are the users of that educational facility, and that will be done, and that can only be done in conjunction, I think, with the school administration and the recommendations of the local public health authorities. And then again, that person would have to go back to their treating physician and say, here's the situation. These are the protective measures that are being suggested, and with these protective measures in place, is this a situation that presents an acceptable level of risk given my particular situation?
Thank you. Really appreciate that. And at the moment, we're starting to answer most of the questions that have been submitted, and we'd like to thank everybody who has submitted those questions. But just before I close up the webinar, I was wondering if there are any particular comments that our panelists would like to share, or any trends or questions or supports, or any sort of parting words you'd like to share before I close up the webinar for today.
I would just like to add, in addition to Samantha's earlier comments about the tremendous effort that we know kidney patients, dialysis and transplant patients have made throughout this pandemic and continue to make, your patience with all of the additional requirements and restrictions within the units, recognizing that the vast majority, I suspect, are attending on their own without the support of family members or friends who normally accompanied you. We recognize that this has been an extremely difficult time and continues to be, and really want to commend your extra special effort and consideration of the staff who are also dealing with a tremendous amount of stress. So your patience, your perseverance, and your ongoing commitment to your treatment in this unprecedented time, really, we can't overstate how much we admire you, we appreciate your effort, and we hope that you'll reach out to your team if you feel in need of any additional support.
Sorry, I've just lost your audio there, Michelle.
Oh, I think I just muted myself. Thank you so much for this opportunity as well, Janice and Lydia, and all of the sponsors. We're honored to be able to partner with you in this way, and Rachel, having you join us has just been so great.
Thank you. It's been a pleasure to host this webinar and to have such wonderful panelists appear at our webinar who have voluntarily given up their time to be here today and to answer all your questions. And if there are any further questions or any other comments you would like to make, please contact Janice at kidney.ca, and her email address is up here. Also, if there are any other future topics for webinars that you'd like to hear from the Foundation, please let us know. We would like to address your needs and meet your expectations and give you the educational opportunities that you're looking for. And you know, we're looking at some future webinars that include some information on diet and nutrition during these COVID times as well. So you know, please keep an eye out for that. We're in the early planning stages of that particular webinar, but as we move forward, I just would like to thank you all and for participating, and we will address any of those questions after the webinar as we move forward. We'd also really like to thank CANSW, so the Canadian Association of Nephrology Social Workers today, together with the Canadian Society of Nephrology, for collaborating with us to share this important information with you all today. CANSW is a group of nephrology social workers from across Canada dedicated to providing support, information and resources to one another, and to provide the best possible care to our patients with chronic kidney disease and their families. The Canadian Society of Nephrology is a society of physicians and scientists specialising in the care of people with kidney disease and research related to kidneys and kidney disease. And the Kidney Foundation is committed to providing information and educational resources about kidneys and kidney disease. Through our regional branch offices, we offer advice and support about accessing services within the healthcare system, assisting people to access other supports in the community, and offering assistance in skills for self-advocacy. We invite you to connect with us if you have any further questions, to speak to someone in your community, or to access further educational materials and resources. Thank you.
Thank you so much, Lydia and Janice, for making this happen, and to everybody who participated. Thank you.
Thank you to everyone for attending this webinar, COVID, Kidneys and Coping, Ask Your Social Worker. When the webinar has ended, your computer will open to a new page requesting that you complete our webinar satisfaction survey. You will also receive a follow-up email that includes a link to the survey if you'd like to complete it later. Your feedback is important to help us improve our webinar series, so we appreciate if you will take a moment to complete it. You will also receive a follow-up email within 24 to 48 hours with a link to view the on-demand recording of today's webinar. On behalf of the Kidney Foundation of Canada, the Canadian Association of Nephrology Social Workers, the Canadian Society of Nephrology, and our presenters, thank you for joining us today. Stay well and enjoy the rest of your day.